Choosing how to feed your baby is one of the most important decisions you'll ever make. This decision will impact your baby's health from the day they are born and into their adulthood. You have probably heard a lot about breastfeeding and formula feeding from your friends and family. You may have heard mixed reviews, or you may have heard that one is easier. For the past few decades, researchers have been studying human milk and have published convincing findings in medical journals around the world that breast milk is not just a complete food for babies, but it also provides protection from many diseases and has a special combination of fatty acids that optimize brain growth. Let's look at some of the differences between breast milk and formula. Babies are born to breastfeed, and your body is made to breastfeed your baby. Breastfed babies are less likely to suffer from ear infections, allergies, eczema, and respiratory diseases like asthma. They are also at lower risk for sudden infant death syndrome or crib death, leukemia, diabetes, and obesity. The longer a baby breastfeeds, the more protected he or she is from these issues. Breastfeeding also has benefits for you too, Mom. It burns an extra 500 calories a day, helps build up the iron stores in your blood, reduces your risk of developing diabetes, heart disease, stroke, and several types of cancer. The protection is cumulative, so the longer you breastfeed in your lifetime, the more protection you have. Formula was created by scientists as a substitute for mother's milk to feed a baby when a mother is not able to. Babies can get the basic and essential protein, fat, and calories from infant formula in order to grow, but they cannot get the breast milk specific protection from diseases and the other important components that provide baby what they need for optimal brain growth. You should consider the cost of formula into your decision also. Formula may be a financial imposition on your family at a minimum of $1,200 per year and $2,500 per year if your baby needs hypoallergenic formula, and neither of those numbers include bottles or other feeding supplies. Mother's milk and infant formula both have some of the same building blocks, including proteins, fats, and carbohydrates. But as you can see, there are many things in breast milk that cannot be created and added into formula. Breast milk and formula are not equal. Many studies from around the world have shown that breastfed infants are healthier throughout their lifetime. One of the most unique qualities of human milk is that it can change slightly in content from day to day, week to week, and even throughout the day to meet the changing needs of your growing baby. We are very fortunate in this country to have the option of formula for situations when babies cannot receive their mother's own milk. Based on what we've discussed so far, you can tell it is impossible to make a substitute that is equal to breast milk. Formula can help babies grow, but cannot protect against disease or positively affect brain growth. Babies have been breastfeeding for as long as we have existed. There are benefits for both mother and baby that continue long after the breastfeeding has stopped and accumulate the longer the breastfeeding continues. Even a small amount of breast milk provides special properties and protection that can only come from you. Now that we've learned how good breastfeeding is, let's look at how your body and your baby work together to produce milk. For as long as humans have existed, mothers have given birth and babies have breastfed. Your body is designed to produce milk, and your baby is born to breastfeed. Knowing the basics of milk production will help you get a great start and continue to produce milk for your baby as long as you choose to breastfeed. Hormones in your body during pregnancy encourage milk ducts and other specialized tissue to grow in your breasts. Your breasts may become tender and your bra size may change. About halfway through your pregnancy, your breasts will begin making early milk called colostrum. You may have also noticed some other changes in your breasts since you've been pregnant. Your areolas may be getting darker and bumpy. These bumps are called Montgomery glands and help attract the baby to your breast. Sometimes colostrum begins to leak from one of the tiny openings in your nipple. This is a normal part of your body preparing to feed your baby. Not all pregnant women leak colostrum during pregnancy, and it is important to know that not leaking colostrum does not mean you can't breastfeed when your baby arrives. Your baby has arrived. The golden hour is the first hour after your baby is born. This is an important time of transition for you both. Studies have found that mothers and babies should be placed skin to skin as quickly as possible after birth to allow for the healthiest, safest, and easiest transition. Skin-to-skin contact and early breastfeeding are also very important for babies born by C-section. Immediately after the delivery of your baby and the placenta, your body is triggered to begin milk production. Colostrum is already present in your breasts and is all your baby needs for the first feeding. In about 2 to 3 days, your colostrum will begin to change into mature breast milk and increase in volume. You have probably heard this referred to as your milk coming in. Your baby will need to eat 8 to 12 times a day in order to bring in and keep your milk supply. The more your baby breastfeeds, the more milk you will make. Remember, it takes practice and patience to be successful at breastfeeding, and if you are having trouble, ask for help early. Don't wait. Your breast milk is all baby needs for the first 6 months. There is no need for supplemental formula unless it's medically necessary and specifically ordered by your baby's healthcare provider. Your baby's stomach is very small at birth, about the size of a cherry, and can only comfortably hold about a teaspoon or so at each feeding. That is about the same amount of colostrum your body produces in the first days after birth. Your baby's stomach grows a little bigger each day and by 1 week is about the size of an apricot. As your baby's stomach grows, your milk production will increase to meet your baby's needs. Milk removal is key to making more milk. The amount removed from the breast by breastfeeding or milk expression determines the amount of milk your breasts will make. Skipping feedings, restricting time allowed on the breast, giving supplemental formula, or rigid scheduling of feedings will lead to a decreased milk supply. Remember, supply and demand. The more frequent the feedings and the more milk that's removed from the breast, the more milk your breasts will make. It takes time and patience for you and your baby to learn how to breastfeed. The important thing to practice is getting a deep latch. Try to get as much of your areola in your baby's mouth as possible, not just your nipple. Breastfeeding should not hurt, so if it does, ask your nurse or the lactation consultant at the hospital for help. A baby with a good latch will breastfeed and remove milk from the breast effectively. There may be some initial soreness or sensitivity when latching, but breastfeeding should be comfortable. If your baby isn't latching well, it can lead to painful breastfeeding, cracked or bruised nipples, a fussy baby, and a decreased milk supply. When a baby latches only on your nipple, they cannot empty the milk from your breasts. A nurse or lactation consultant can help you correct the latch and fix the problem before it gets too serious. The first few days of breastfeeding are a time for you and your new baby to get to know each other, to learn to breastfeed, and to begin your new life together as a family. On the first day of life, you and your baby are tired and recovering from the birth. Your baby will probably breastfeed several times, but may be very sleepy and not interested, but you must wake your baby to eat. Over the next couple of days, your baby will have more wakeful periods and will begin to show signs that he or she is ready to eat, like squirming, opening and closing their mouth, licking their lips, and trying to eat their hand. Sometimes you and your baby may get frustrated and cry. That's okay. It takes practice. When getting positioned for breastfeeding, be sure you are comfortable, whether you are sitting or lying down. Use pillows to elevate baby with his ears, shoulders, and hips in a straight line. By 3 to 5 days, you should notice your breast feeling fuller as your milk volume increases. You should still be feeding your baby 8 to 12 times in a 24-hour period. Your baby may eat on just one or both breasts each feeding. Sometimes babies breastfeed every hour for several hours, then sleep 3 to 4 hours before the next cluster of feedings. Your baby may seem more satisfied after some feedings and may have fussy periods when it seems like all they want to do is eat. This is completely normal, and it does not mean you don't have enough milk for your baby. Over the first 5 days of life, you'll notice your baby's poop changing from dark green or black meconium to loose and seedy yellow. This is another normal change to look for. Before you leave the hospital with your baby, make sure you have seen the lactation consultant or spoken with someone about breastfeeding. You should feel comfortable and confident about breastfeeding before you go home. Your baby must see the pediatrician or healthcare provider for a weight check 2 days after you are discharged. The first few weeks are often the most intense and difficult weeks of breastfeeding. We refer to this time as a roller coaster ride. There will be ups and downs during these few weeks, but they will be over before you know it. You may be exhausted, and it may seem like the baby wants to eat all the time. You may worry that you don't have enough milk. Hang in there. It's not unusual to feel this way about breastfeeding. It will get so much easier soon. But you may still be wondering, how do I know if my baby is getting enough? Did you know the number one reasons mothers stop breastfeeding is because they think they don't have enough milk? Have confidence in your body's ability. Your body grew this baby, and your body can feed this baby. The first few weeks, your baby is still getting used to life. Until recently, your baby has been inside you, being held and rocked as you move throughout the day, being fed without effort through the umbilical cord. Your baby now needs to learn to do so many things: eat, sleep, breathe, process the senses. It can be very overwhelming for a newborn. Your baby's eating and sleeping patterns will change daily as he or she grows, and your milk supply is just getting established. Remember to watch the baby, not the clock. It is normal for newborns to feed frequently. As your baby gets older, he or she will become more efficient with breastfeeding, and his or her stomach will be getting larger, so feedings may get shorter and spaced further apart. But how can you really know if your baby is getting enough milk? It's important to remember what goes in must come out. So pay close attention to the amount and consistency of your baby's diapers. If your baby is over 5 days old, breastfeeding 8 to 12 times a day, has at least 3 poopy diapers that are yellow and loose, then you can feel assured that he or she is definitely getting enough milk. You may notice times when your baby wants to eat much more often. These times are referred to as growth spurts. Growth spurts can occur anytime, but are common around 10 days, 3 weeks, 6 weeks, 3 months, and 6 months. Some people may incorrectly tell you that eating frequently is a sign you don't have enough milk or that your baby needs formula. This is not true. Growth spurts are normal behavior. Breastfeed the baby as often as he or she wants, and after about 2 days, the feedings will return to normal as your body adjusts. In the days and weeks following childbirth, you may experience mood swings, feel sad, anxious, or overwhelmed, have crying spells, be sleep deprived, or lose your appetite. These feelings are commonly referred to as the baby blues. Taking care of yourself is the best way to lessen these symptoms. Ask for help around the house or with any other children. Get outside the house, even if it's only for a few minutes every day, and try not to expect too much from yourself. It takes time to heal from the birth and to adjust to life with a newborn baby. Be gentle and patient with yourself. If any of these symptoms last 2 weeks or longer, if you have the inability to sleep, no interest in caring for yourself or the baby, or if you have thoughts of hurting yourself or the baby, please be sure to call your doctor or midwife. Hormonal changes after birth and lack of sleep increase your risk of developing postpartum depression. Your doctor or midwife will be able to help, so please let them know immediately if you are feeling this way. Breastfeeding will give your baby the healthiest start in life. It takes practice and patience. Ask your provider about additional prenatal breastfeeding classes available through the hospital.